We are now joined by Dr. Brett Owens, University Orthopedics. Doc, thanks for coming in and joining us. It is a lot of injuries going on right now in the Boston sports landscape. Of course, we had Jason Tatum a few months ago. Now we have Christian Gonzalez. That's the one that's top of mind right now, along with Roman Anthony. But let's start with Gonzalez's hamstring injury. And it looks like it's lingering a little bit. How do you usually see those with football players?
Yeah, sure. So a lot of injuries, but it's that time of year, right? And it's an exciting time as a New England sports fan because you have, about to start the NFL regular season, and then of course we're in a little bit of a playoff hunt. So the Sox are hanging in there in the AL East as well as in the hunt for the wild card. So it's an exciting time.
It is, no doubt about it. For Gonzalez, how important is it that he doesn't rush back from a hamstring injury?
Yeah, hamstring or lower extremity strains are one of the most common injuries in football. In fact, in the NFL, about 1 in 4 athletes will experience a lower extremity strain. The majority of those are hamstring strains. And that muscle crosses 2 joints. So it crosses the hip and it crosses the knee, and that's where we see a lot of those pulls of the hamstring, especially in athletes that are doing a lot of running. We see it a lot in preseason. We see a lot in defensive backs, which is him, and certainly the higher risk of re-injury, which we're trying to avoid, is with early return. So I think they're trying to take advantage of some of that time they have before the start of the regular season, because it is a long season in the NFL, and we want to be able to get him back full go. So he did not practice today.
No, he did not.
So so that's, of course, I'm sure they want to get him out there on Sunday, but it's a bad sign they didn't practice today, so I wouldn't expect to see him on Sunday.
Right, which makes sense, and it's something that we all expected for Gonzalez to not be out there. How tough is it in your experience when you have an athlete, football player, that you are working on a hamstring?
Sure.
Their eagerness to get back. How tough is that? Does it depend on the player?
It's completely on the player, and it's frustrating because you're trying to prevent something that they don't always see. They feel great, they're ready to go, but it does need more time. The good news is most times these hamstring strains don't require a surgeon. It just requires some patience and a lot of therapy. There are some scenarios if you have a big gap where sometimes an injection can be helpful, but most of the time we're very conservative with these. We allow them to heal in, and the goal is trying to get strong enough and get your motion back fully and be able to move athletically so you don't have a re-injury. As you know, these defensive backs they're at high risk. They're always, they're backpedaling, they're changing direction. They have to be able to start and stop and go full speed with the jumping as well. So it's definitely a high-risk position.
For a hamstring, even if you do take the time to heal it fully, how often do you see a re-injury?
We can see that up to a third of the time that they will have a re-injury over a few-year period. And so, at the highest levels, we want to try to keep them healthy. And that's why, again, the focus in the preseason is about injury prevention, but these injuries do happen with high-level athletes moving at a high rate of velocity, and with collisions, we see that a lot. So
yeah, and now switching gears to Roman Anthony, another tough one, oblique injury, and it seems that he did re-injure it. He injured it a few months back, and it was either a few months back or a few weeks back, but moral of the story, he re-injured the same oblique that he tweaked. He said it felt worse this time.
Yes.
4 to 6 week period, do you think that's a little bit on the safer side, or do you think that's something that's okay, he's going to be out for the rest of the year?
Well, I think they've declared him being out for the rest of the regular season, hoping to have him back for playoffs if we are in playoffs. Certainly we're seeing the opposite scenario here, where playoffs it's not the beginning of the season. We're heading into the postseason, so I think they may have to lean a little bit more aggressive. Most oblique strains, are able to be healed in a 2 to 3 week period. Certainly more severe strains, it can take 5 or 6 weeks, but I think we'll see him most likely in the playoffs.
So that's the hope, is that they get him back for the playoffs. For obliques too, similar thing where it's easy to re-injure them?
Certainly is, especially with all the torque that's required in batters that are constantly straining their core. So your obliques are kind of these when we think about the six-pack core, but those are the abdominal muscles that are to the sides of that six-pack, so to say. And especially with batters, all of that core energy it's easy to strain those.
Yeah, no doubt. And he said that it's never felt like that before. He hasn't dealt with an oblique injury, so that could also be something that could be concerning.
It can be. He's young, so they definitely want to be able to try to be patient with it. But with these young players, they certainly, when they have the opportunity to be in the postseason, they want to be able to play. So I'm sure they'll be able to put all the modalities, all the therapy at them, and be able to make a push for the playoffs.
No doubt. Let's hope, right? Let's hope. Injuries, they just ruin everything, But Dr. Brett Owens knows all about it. We appreciate your time, sir. Of University Orthopedics, thank you for joining us.
Thanks, Sam.